Today.
I love it.
No.
You're by me.
Hi. Hi, me. Nice to meet you.
How are you?
Oh, well, okay.
Crawl down one.
Cheers. Hi. Mic off. I'll turn yours up. So that's you. It's me. Yeah.
I'd like to call to order this meeting of the First 5 Sacramento Commission for Monday, October 1st. Madam Clerk, will you please call the roll and establish a quorum?
Dave Gordon. Here. Beth Hassett. Terrence Jones.
Here.
Olivia Kasiri. Bruce Wagstaff.
Here.
Scott Moak.
Here.
Donna Sneringer.
Here.
Steve Wertz.
Here.
Lee Turner Johnson. Kathy Cossack.
Here.
Terry Porter.
Here.
Christina Elliott.
Here.
Patrick Kennedy.
Here.
Phil Cerna.
Here.
We have a quorum, and with Beth Hassett being out today, Steve Wertz will be voting in her place, and Olivia Kasiri is out, so Kathy Cossack will be voting in her place today. This meeting of the First 5 Sacramento Commission is cablecast live on Metro Cable 14, the local government affairs channel on the Comcast, Consolidated Communications, and AT&T U-verse cable systems. This meeting is closed caption and webcast at www.sacmetrocable.tv. Today's meeting will be repeated Wednesday, October 3rd at 9 a.m. and Friday, October 5th at 2 p.m. on Channel 14. Members of the audience wishing to address the commission may sign a speaker slip at the kiosk located in the back of the room. Please include the agenda item number that you wish to address and then bring the completed form to me. Please speak into the microphone when addressing the commission and state your name for the record. If you have any electronic devices, please put them on silent or turn off now. Thank you.
Thank you. Will you please rise and join me in the Pledge of Allegiance? Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Again, I'd like to welcome everyone to this afternoon's First 5 Commission meeting. As another reminder to those that have joined us here in chambers, you're certainly welcome to address the commission on any item that's on our agenda or any item that's not on our agenda. We only ask that you please fill out a speaker slip and give it to our clerk. And we ask that you keep your testimony to 3 minutes or less so that everyone has a chance to speak and address the commission if they so choose. Before we get started, I want to welcome back to the commission Mr. Wagstaff. Bruce is someone that I had a chance to work with in my first term during his tenure here at Sacramento County, and is now serving in the capacity as our one of our deputy executives in charge of countywide services. And I'd like to give you an opportunity, Bruce, if you'd like to say anything before we get underway today.
Well, thank you, Mr. Chairman. Just to say that I'm glad to be back. I was on this commission for a few years previously. I went down to Santa Clara County, was the director of social services down there, and was on their commission for a while. So, I just recognize the very important work that we do here, and I'm just excited to be back and be part of it. Thank you.
Thank you. All right. With that, I'll ask the clerk to read the first item, please.
There are 2 consent items for your approval today.
Okay, we have the approval of the August 6, 2018 draft action summary. Any commissioner wish to pull that for a separate vote? If not, I'll entertain a motion. Been moved by Commissioner Jones. The chair will second. All in favor? Aye. Opposed? Abstained? Motion carries. Thank you. Item 2 is approval of the 2019 commission meeting calendar. Have my colleagues on the commission had a chance to look at this, and is there any objection to the calendar as it's been proposed? Commissioner Wirtz, are you chiming in?
No.
Okay. Seeing none, I entertain a motion.
I so move.
Okay, it's been moved by Commissioner Wirtz,
A second.
second by Commissioner Moak. All in favor? Aye. Opposed, abstained, motion carries. Thank you. All right. All right, well, let's get to the first item under separate matters, please.
Public comments on non-agenda items.
Okay, again, this is the public's opportunity to address this commission on any matter not on our printed agenda today. I'm not in possession of any speaker slips, nor do I see anyone coming to the podium, so we will move on to the next item, please.
Executive Director's Report.
Good afternoon, Commissioners.
afternoon.
Good to see you all again. I just have a couple of items to highlight on the Executive Director's Report. First, I wanted to go over some of the bills that we have supported this year as part of our Policy Advocacy and Sustainability Committee. I'll walk you through a couple, and I'm going to tag team this with Commissioner Sneeringer, who is going to talk a little bit more in depth about the early learning bills. So while the governor did veto AB 11, this was our developmental screening bill, was the first bill that First Five Association actually co-sponsored. It's the bill that would have mandated developmental screenings take place with a standardized tool at pediatric visits. And even though it was vetoed, kind of not all was actually lost. The Department of Health Care Services, which did oppose this bill, has actually agreed to send out an all-plan letter that basically mimics the language of AB 11. So kind of saying that they're going to take care of it on their own. We'll have to make sure that that actually happens. But in a roundabout way, actually, I think that this bill sort of shined enough light on the issue that Department of Health Care Services felt the need to do something about it. So it may have served its purpose without even being approved. SB 937 was a workplace lactation accommodation bill, which would have required employers to have in place a lactation policy and to provide a safe space for employees to for lactating employees to pump. That bill was vetoed by the governor, unfortunately. And we actually have a full presentation later on in the commission about breastfeeding services in the county. And so this could be one of our next steps, is to just continue to follow up on this and see how what we can do as a county commission to help pass something like this at the state level. Our early care ones, I'm going to turn over to Commissioner Sneeringer. There were 2 that we were following, and 2 additional ones that she wanted to talk with you about.
3 we were following.
Oh, 3 we were
Yeah.
following, sorry. You go.
So the updates included AB 2960, which was signed by the governor. It was a bill by Assembly Member Tony Thurmond. Recent changes in the federal child care and development block grant are requiring California to have a single statewide database of all child care information, and this bill was another step toward that process by seeding a stakeholder group to put a new portal for families together that would have all the different aspects of the early childhood system in one place. So we're very pleased. It's the beginning of a process, but it's the state continuing to move into compliance with the new federal rules. AB 2292 was a bill by Assembly Member Aguiar Curry, and it was held in Senate Appropriations, but we were supporting that bill, and I just wanted to ensure that you all knew that a good portion of that bill was actually adopted in the state budget. And it was one of those bills that had a budget and policy strategy, and the key component of it was increasing reimbursement rates for infant toddler programs, and that did happen. AB 2626 was signed yesterday, and it is a bill that many early childhood advocates have been working on. There have been many county pilots to look at different aspects of the statewide subsidy system, and this was was the bill to start to take those to scale at the statewide level, and was lovingly referred to as a statewide solution bill. The big components that are important locally is it's going to return 2 professional development days to all of our child development contractors, which was lost during the recession. It's going to allow for a little more flexibility of managing funding, and I think it's a good step in the right direction so we don't end up with an even more bifurcated system. And the last one is one that I've worked on a lot, which I think will have some impact here locally. AB 605 was carried by Assemblymember Mullen, actually both these last two, and it is an effort that had been spearheaded by the California State Head Start Association to create a single center-based license. California is one of very few states left that have 4 different license types for center-based programs, and it makes it very hard for programs to adapt and be nimble and respond to their community. And this will start a regulatory process to consolidate that into one. So,
Great. In other news, county commissions move deeper into our policy and systems change work, the association has sort of stepped up to the plate and held a all-day workshop, a policy workshop, which we fondly dubbed as the Policy Hackathon. And we know the premise behind it is that so many of you commissioners and commission staff have deep knowledge of early childhood and of early childhood systems, and we also know the people who run those systems, either at the county or state level. And so trying to use those relationships and our knowledge to further our influence to make the changes that we think would streamline those systems, make them better for kids. So this was our first full day of all getting together. We broke out into 3 sessions. I led the comprehensive health and development section. There was also an early learning and a family resiliency. Based on all the feedback, the association's pulling it together from each of the breakout sessions, and they will use that to create their 2019 policy platform. And you all know that we have our own First 5 Sacramento policy priorities that we've developed. We update those annually. We usually stay pretty close in line with the associations, but some of ours might be a little more county specific. And that's on an upcoming agenda after the new year. We'll present those after they go through the Sustainability Committee. And then speaking of sustainability, and our Certified Sustainable Initiative is fully launched now. We had 2 webinars last month to help, led by our Eric Harold, to talk about the template that we're using as well as the budget worksheets. So as you know, each agency is mandated to develop their own strategic plan or sustainability plan that includes a 5-year budget and how they would potentially leverage other dollars and bring in new revenue to continue serving the kids even as our funding decreases. So we had more than 50 providers were on those 2 webinars, great turnout, answered lots of questions back and forth, and are getting everybody back together again after the new year. And then in the evaluation update, I'm really happy to report that our Birth and Beyond partners are now inputting their data directly into the Commission's Persimmon database system. So this transition not only saves money by eliminating the need for CAPC to have its own data system, but it also eliminates the need for uploads from one system to the other system where lots of errors can occur. So we continue our quest to get cleaner, better data with which to show the effectiveness of our programs. And finally, I usually like to highlight a new activity or an event that our partners are sponsoring. This time I'd like to talk about Her Health First, which launched a Walk with Friends event for women who are participating in their Black Mothers United program, which is the pregnancy mentoring program that First 5 funds. And they had women walking out in the fresh air, making friends who are also pregnant, and discussing how to reduce stress while pregnant. So Commissioner Turner attended that event on our behalf. And I guess lastly, I think everybody got in their packet one of our Help Me Grow postcards. These were created by our partners SCOE and Wormline Family Resource Center. So we're distributing these, getting the word out about our call line. And then I don't have a sample, but we'll share with you next time. They also created this really cool prescription pad for pediatricians who, if they wanted to write a prescription, if you will, for the Help Me Grow line, they basically tear it off and hand it to a family if they think that family has additional questions about development that they didn't have time to get to in their visit, or wanted them to have a further assessment. So that is going along really well, and that concludes my report.
Great, thank you. Any questions for Julie? All right, seeing none, thank you. Can we have the next item, please?
Advisory Committee update.
Okay. Mr. Silva?
I don't think he's here, but I can give a quick update.
Okay.
Yep. So we met on August 10th and had a presentation from Dr. Melody Law. She's the Assistant Public Health Officer, and she gave us a PowerPoint presentation on the use of marijuana during pregnancy. What we thought was going to be about a 20-minute presentation was like an hour and a half. The group was really interested, had a lot of questions. There's a lot of dialogue. We even ended up sending out some follow-up information to the group. So it was pretty deep and I think meaningful discussion. And then our own Latina Price gave an update on Certified Sustainable and where we were at with our work with our partners. And then Eric Harold went over our budget and 10-year financial plan. So it was a full meeting. And in other news, I hope to bring you by the November Commission meeting at least 5 new appointments for your consideration to the committee. We've been doing a lot of recruitment over the last 6 months, and I think I am going to be able to fill 5 of our 8 vacant seats. So I'm happy about that.
Does that conclude your report?
That is it.
Okay, very good, thank you. Let's move on to evaluation.
Evaluation Committee update.
Thank you.
I don't know.
Report that the
This is
Evaluation Committee did meet on September, is that on?
Don't think so.
Okay. Is that on? There's 2 choices I have here. Right. Excuse me. So September 17th was our meeting. We did not have a quorum at the meeting, but we did go ahead with staff and our participants to do several things. First, as Julie just mentioned, a big highlight was the Birth and Beyond process of transitioning to the Persimmon system. And we learned the reports that training has been going on for the use of Persimmon, and all the first 5 California annual report is into the system. Quarterly reports are due at the end of this month. We also looked at the calendar and for the evaluation committee and have one change from our normal time frame. Our November meeting is going to be moved to this month, October 15th, to ensure that we can review the Reducing African American Child Deaths presentation. In addition, I just wanted to highlight that we spent a good amount of time discussing both the school readiness transition summer camps issue, and I think we highlighted the reality that with less evaluation funding, we're going to be doing less in-depth evaluations around that program. We were, though, spent a good amount of time then talking around the Reducing African American Disparities data issues, and I think trying to make sure in the report that we're clear. There's whenever we report data on a time period, the question is always, is this the report time period? So the report will be 2018, but the time period is what has to be clarified in terms of whether it's the full year of 2017, whether it's the multiple years of people enrolling in a program. So you can see that I'm having trouble explaining that. We want to have a report that makes that as clear as possible so that when we track the outcomes, we know which part of the evaluation is being conducted for the Reducing African American Deaths project. It's not an easy task. We worked with our evaluators. We're trying to make sure we partner with the county in terms of the data that we're getting from them. But just to be clear, we've got the intervention part of the time period, and then we've got the follow-up. Because if we're going to measure, for example, one of our distal outcomes is infant mortality rates, you have to wait a year after the birth in order to measure that. A lot of work was done. I think staff is following through with our evaluators to try to make that come to you as clear as we can. And as you can see, it probably will have some questions when we arise for that. Other than that, I think we then looked at the first 5 Sacramento annual state report outline, and we're moving forward on that as well. So I think with that, I will stop and make sure if there's any further additions, staff can add them.
You got it.
Okay.
Thank you. All right, next.
Financial Planning Committee update.
We have not met since our last commission meeting. We are meeting this coming Thursday.
Thank you.
Sustainability Committee update.
The Sustainability Committee met on the 21st of August, and much of what we discussed was in the Executive Director's report, so I won't repeat it. We did spend a good deal of time looking at the results of the breastfeeding survey, which you're going to be seeing later in the meeting, and had quite a bit of conversation, actually, about it. Our next meeting is November 21st.
Very good, thank you. Okay, item 9.
Authorize the Executive Director to amend the revenue agreement with Sacramento County Department of Child, Family, and Adult Services to receive an additional $325,000 in funding for the Birth and Beyond program, and to amend expenditures contracts for the Birth and Beyond collaborative members for a total increase of $325,000.
Thank you.
That's a mouthful.
Yeah, it is.
Sorry. But
Very thorough.
Thank you. You definitely wanted to know what you're voting on today. So as you all know, that due to our strategic spending down of our reserves over the last year, our strategic plan had a $5 million reduction, which was a 20% cut to our new budget. And our Birth and Beyond Family Support Collaborative received 15% cut for this new strategic plan period. And in fiscal year 18-19, that cut equals $1.35 million, or approximately $325,000 per quarter. So back in June, the Sacramento County Board of Supervisors approved their recommended budget for fiscal year 18-19, and it included an allocation of $325,000 to Birth and Beyond to cover that first quarter from July through September. And then subsequently at our meeting on August 6th, the commissioners approved that revenue agreement and directed staff to amend the contracts with Birth and Beyond partners to move that $325,000. So fast forward to the next month, and at the September 5th Board of Supervisors meeting, the board approved their adopted budget for fiscal year 18-19, and that included an additional funding for Birth and Beyond of $325,000 to take them through December 31st. So now a total of $650,000. And that money also would come through First Five. There's 3 really good reasons for bringing it through First Five instead of just going straight through the Department of Children, Family, and Adult Services. First, we are able to use those funds to generate MA revenue, so we can leverage our MA dollars. Secondly, it was going to ensure that there's no disruption of services for the families while they would scramble to get a contract in place. And third, First Five continues now to monitor all the home visiting through Birth and Beyond for 0 to 5 children and families, which is important to us for our data. And I think is helpful to the Birth and Beyond collaborative partners in just having one place to go for everything 0 to 5. So this funding, like I said, is in addition to the $325. It brings us up to $650,000 and through December 31st. It'll allow for continuity in services as the County Department of Human Assistance is working on their competitive bid process for brand new CalWorks home visiting dollars. Those dollars are anticipated to begin in January of 2019 and could potentially be used to, again, offset the First Five reduction. So more to come on that as it works out. But staff is recommending to amend the current revenue agreement and to accept the additional $325 and then to amend our contracts to get that money out.
$325,000.
$1,000, sorry, yeah, $1,000.
Okay, does that conclude your report?
That does.
Okay, any questions for Julie or staff? Commissioner Gordon?
I was going to move the item.
Okay, very good.
Second?
Okay, it's been moved by Commissioner Gordon, seconded by Commissioner Wagstaff. Roll call vote, please.
Dave Gordon,
Aye.
Steve Wertz,
Aye.
Terrence Jones,
Aye.
Olivia Kasuri,
Aye.
Bruce Wagstaff,
Aye.
Scott Moe,
Aye.
Phil Cerna.
Aye.
Motion passed.
Good, thank you, and thank you to Julie and her very capable staff, as well as our staff at the county for getting this done. I know this is very important to a lot of people, many of whom are constituents of Supervisor Kennedy and I, so I appreciate that.
Absolutely.
Next item, please.
Public hearing, review, and adoption of an annual report to First Five California for fiscal year 17-18.
Okay.
Carmen Garcia Gomez will be handling this one.
Good afternoon, Commission.
Good afternoon.
Well, it's that time of year again where we report our numbers served to First Five California. This report is due to First Five California by the 1st of November of every year, and this commission, the State Commission compiles and analyzes the data for each county for inclusion as an aggregate number, and so we are really just uploading the data to First Five California, and they put together their annual report, and we come back in the spring and share that with you. This particular year, First Five California changed the format in which the report is completed and uploaded. So in previous years, you may notice that the report was a lot thicker than it is this year. We used to report outcomes in 2 specific areas in the AR2. They are no longer requiring that. What we are now doing is in AR1, which is the financial portion of the report. That is where all of the numbers served are attached to result areas. And if you notice, their aggregate numbers, so from result area to result area, there is some duplication. AR1 includes the revenue detail, expenditure detail, as I mentioned, clients served by result area, the expenditure detail in whole, the net change in fund balance, and the fiscal year 2017-18 fund balance. This last fiscal year, our expenditures totaled $23.1 million compared to $22.5 in the previous year. We ended our year with a fund balance of $32.9 million. The AR2 is the demographic worksheet where we look at the numbers served as an aggregate duplicated number, as well as the demographics and language and ethnicity. This last year, First Five Sacramento contractors provided services to 56,223 parents, children, and providers. and that's a duplicate number. The unduplicated count is 22,989. Now, the duplicated count is a decrease by 4,156 from the previous year, which is, it may sound bad, but it's actually a good thing. It just means that our data is cleaner this year. And our unduplicated count, there's an increase of 2,757, which is good news because, again, it's just cleaner data. The ethnicity of parents and children remains for the most part the same as previous years, as well as the primary language spoken. Now, in section 3 of the report, you have your county evaluation summary, which includes a summary of evaluation activities that took place during 17-18, as well as policy changes. This year, we are taking the opportunity to highlight our certified sustainable work in the county highlights. So you will see that printed in the Commission, First 5 California Commission report in the spring. That concludes my report.
Thank you. Any questions for Carmen? All right, seeing none, entertain a motion. The chair will move it. Is there a second?
I'll second.
And seconded by Commissioner Moak. Roll call vote, please.
Dave Gordon,
Aye.
Steve Wertz,
Aye.
Terrence Jones, Olivia Kassiri,
Aye.
Bruce Wagstaff,
Aye.
Scott Moak,
Aye.
Phil Cerna.
Aye.
Motion passed.
Very good, thank you. Next item, please.
Presentation of Sacramento breastfeeding survey findings.
Okay.
Going to ask Linda Fong-Samara to come to the podium and give us a brief PowerPoint presentation on the findings of our survey.
Commissioners, I'm Linda Fong-Samara. I'm the Health and Program Planner. We'll just wait a second for the PowerPoint to come up. Great, thank you. So just a little bit of background on why we conducted the survey. Make sure this works. Okay. Why we conducted the survey and how we got here. As you all are aware, this commission has been funding breastfeeding support services for well over a decade. We've had a partnership with DHS WIC and Community Resource Project WIC, and they have been doing a wonderful job serving tens of thousands of women by providing a breastfeeding support helpline. They have one-on-one appointments available with lactation consultant. They even provide home visits. And all of this effort and all of this work has really helped many moms in our local community really initiate breastfeeding and continue breastfeeding. And we're all about supporting the guidelines that say that moms should exclusively breastfeed for the first 6 months of an infant's life and should continue breastfeeding for the next 6 months with the introduction of solid foods. In addition to that, this commission has also supported policy change at the local hospital level. So in the past, we funded baby-friendly support practices and trainings and provided technical assistance to help shift policies. Can you hear me? There we are. Thank you. So that we can really change what happens from the get-go as soon as babies are born, and those hospitals are really promoting breastfeeding, skin-to-skin support, and really getting moms the help they need to get started with the breastfeeding. So as we've progressed along the way, there have been some policies that have been passed that actually encouraged us to take a little bit of a step back from baby-friendly, and we now have included some language in our sustainability plan at the commission level. And so as you can see, the Affordable Care Act is actually supposed to provide for breastfeeding support supplies and services. So our role as a commission was to look at monitoring those federal and state legislative actions and see if ACA is really implementing what they said they would do. So with this, as we're looking at long-term systems change and how we can have that lasting impact, we decided that before we came up with any potential strategies as a sustainability committee and as a commission, we wanted to see what's happening out there in the community and test some of our assumptions that we have heard. Just anecdotally in the community, we've heard from some moms that they have challenges getting a breast pump. They have challenges finding out what services that they can access and where to find them and how to get them and can they afford them. So we wanted to delve a little bit deeper again before we could figure out what our next steps were. So we decided that one of the things we could do was to implement a breastfeeding survey. And we did two different kinds of surveys. We did a provider survey, because we wanted to look at what's happening at the systems level, but we wanted to hear directly from moms. So we worked with the UC Davis Masters of Public Health student named Yesenia Figueroa, and she did a wonderful job in a very short amount of time to gather a lot of information for us. The goals of her project were, again, to look at what's happening in our community, what's that landscape, what types of support do we have available for moms, what barriers are they finding in trying to get access to those services and supports, and if there are barriers, then what strategies could we use to promote utilization and navigation of those services? And then finally, after gathering all this information, what recommendations would she provide to us as a commission for next steps? So she did focus groups in the community. One was at a family resource center. Another one was with Black Mothers United. She had roundtable discussions with lactation consultants, so again, those direct providers of support services to moms. She did interviews with some breastfeeding advocates in the community, a survey of providers, and we were really happy to report that we did an online survey of mothers and some in-person surveys, and we collected 492 surveys. So we were very happy with that response.
I think we have a question from Commissioner Jones.
I just want to clarify about the survey. So you said that you looked at also the health systems. I thought I heard that. So that means UC Davis Med Center, what they're doing, Sutter, Kaiser, Dignity, all of the different health systems, see what their current, how their practices are with. And so is that included in here? Or?
It actually entailed her calling each of the systems and developing a matrix for us of what services are available at each of the systems. And so what she found was 2 of the hospitals offer monthly support groups, 1 offers a bi-monthly support group, 5 offered weekly support groups. Only 2 of the systems have appointments with a lactation consultant, and 2 of the systems actually have services available for their members only. So that kind of gave us a picture of what's happening at the local hospital level. So it's, to answer your question, it's not consistent across all hospitals. It's not open to everyone. And the availability is a little bit scattered.
And do all of them emphasize breastfeeding at the time of delivery for the first 24, at least when I guess the baby stays there or the parent stays there 24 to 48 hours, are they talking about breastfeeding at that point?
That wasn't one of the questions that I believe she asked. What we do know is that the hospitals are all in different phases of becoming baby friendly. We have Kaiser South that already is baby friendly, and so is Sutter Medical Center. Some of the Mercy, or now known as Dignity Health, they are working towards baby friendly, but it is a process. It's not something that becoming baby friendly, it doesn't take like a month or 2. It can take a hospital a couple of years because they have to change the way that they work with patients. They have to allow rooming in. They need to provide some education.
Okay, I had more questions, but I'm going to hold them off for a while.
Mr. Moe?
I just have a question piggybacking off of that. Did she find or ask about the disbursement of formula to new moms?
That wasn't a part of our survey. Our survey was more focused on talking directly to moms, but I can also tell you that as part of the baby-friendly requirement, they're supposed to educate moms on the importance of breastfeeding first, and how valuable it is for the health of baby and mom. However, you cannot tell someone that they cannot have formula, and especially if it's a medical need, you cannot prevent someone from
Sure,
getting
no,
formula.
I understand that. I think the big push, I feel like a while back, was that they're not walking in with all these things, all these supplies, and also a container, a gallon of formula as your, congratulations, your baby's here, you should breastfeed, and here's formula.
Right.
Right? I think that was where they were trying to pull back on that part of it. So my question is, did she find out where in the process each hospital or each system is with that
We don't have that as a part of this survey.
And Amelia probably knows that off the top of her head. But.
WIC would like to add, they can. I do know that as a part of the baby-friendly process, that is all changing. You're not supposed to be promoting formula and having it plastered everywhere. But again, if a mom requests it, you do have to provide it.
It's been a few years since I've been, Amelia Schindel, it's been a few years since I've been kind of immersed in that world, since Lisa's my program manager now for breastfeeding. But the last I remember, the hospital systems that were baby friendly, that have become baby friendly for sure. Formula is not handed out as a sample. Every once in a while, we hear of something like that happened. A mom will complain to us, and we'll get on the phone immediately, and we'll call our contacts at the hospital, and we'll tell them, did you know? And they're like, give me the name, the time of the day, and they'll track it down and try to find the nurse that did it. So there is that heightened state of awareness. Now with Dignity, because they're not baby-friendly yet, I don't know what stage they're in with all of that. Okay. But UC Davis is not baby-friendly certified, but they have policies in place that promote and support breastfeeding. Great. So I hope that kind of answered.
Yeah, that's great.
Okay,
thanks.
Who's playing the part of Beth Hassett today on the Steve, okay.
And I do apologize, I didn't realize that I was playing that with the microphones as well, so I apologize for turning off your mic.
So much power.
So much power.
Yeah, if I had only known.
Wow.
But does this mean that I also could comment on this as well?
That's why I'm calling it.
Okay, thank you.
Yeah, go ahead.
I no longer can tell. So I guess my comment, I really appreciate those two comments. I guess what I'm hearing is policy change is a difficult thing to sustain. And what I'm hearing here is that we may not know enough about the progress we're making with the hospitals in terms of this. And I just wonder if we can, maybe we do, but from the questions there, I just don't think I got that feeling that we know the status of each hospital's progress. And I guess I would like to make sure that First Five is advocating with them, working with them, collaborating with them to ensure that this process of implementing a substantial policy change within their hospital practices around even how NICUs are run and how the system runs in a hospital, that we keep that in mind, that it's just because we think we've got the policy implemented doesn't mean that it's, we got a policy in place, doesn't mean it's being fully implemented. So I guess I would urge us to keep working with them. Do we still have the collaborative that meets around the hospitals around this initiative? And is there a mechanism we might have to follow through to make sure that they understand that First Five is really still watching and wanting to see this happen?
So there's the Sacramento Breastfeeding Coalition. I will say that, again, all of the hospitals are working in some form or fashion on promoting breastfeeding. It's interesting because in some of the information we got from moms, some of them felt that the hospitals provided too much pressure to breastfeed, and it honestly kind of turned them off. And there's a recommendation that see later on around training so that providers are not just more aware about breastfeeding, but how to talk to moms about that. Because again, moms just felt like they were just being shoved down their throats, actually. So aside from that, though, in terms of knowing where hospitals are at, one of the reasons why we stepped back from funding the baby-friendly trainings and the certification, one was because of the decrease in funding that we had available, but also on a larger level all around us, there was a lot of policy change happening that was so much bigger than us. And so one of it is SB 502. It requires all maternity hospitals to have an infant feeding policy supporting breastfeeding by January 2014. So that was right at the time that we were just finishing up baby-friendly work. And since it's a mandate, it really encouraged us to say, well, it's this law, you have to have some sort of infant feeding policy. Then SB 402 was passed, and it says that all maternity hospitals must adopt quality breastfeeding policies, and this actually requires them to either become baby-friendly or there are model policies available by the California Department of Public Health. So again, there are things in place that really push them to incorporate breastfeeding and really promote breastfeeding. The accreditation body, JACO, that accreditates hospitals, they also have infant feeding measures in their process now. So that was yet another way of how this system around us, much bigger than First Five, is really looking at breastfeeding and promoting breastfeeding. So those are ways, again, much bigger than us, that's really pushing the momentum forward.
Commissioner Jones?
Yeah, I thank you, and I appreciate that. And I have, I'm not certain how the hospitals all do this, if they assign a particular lactation, do they have lactation consultants? Do they assign a nurse? Is it a nurse practitioner? But all that kind of formal policy would be interesting to find and see how effective those are. Because I think, from my perspective, giving them more education about that is probably not all that productive, I guess, but making certain that they have a system in place there. But I'm still not clear about who these providers are. Are these like WellSpace, who has a certain number of providers that you're interviewing? Is it, I forget the names of these medical clinics that are out in the... Who are the providers that you surveyed? Are these large provider groups like Dr. Jones, who has a huge pediatric or OB/GYN pediatric practice?
The 10 providers that responded, they're lactation consultants, and many of them found out about us through the Sacramento Breastfeeding Coalition. So there could be a private lactation consultant, they could be someone that works for WIC. They were anonymous, so I don't have the exact names of who they are, where they worked. I just know they're a provider.
Have you ever thought about surveying the big clinics? I don't know the names of them, I'm sorry, but I would think WellSpace. What did WellSpace do with the OB people that they see, the OB/GYN? What do they tell them about breastfeeding prior to the delivery of the baby? What does, these pediatric clinics that we support do? I'm just curious if they're part of that provider.
And that could be one of the next steps, and that is one of the recommendations that we had talked with our intern about. Even though she did a great job gathering a lot of surveys, this was more focused on just hearing directly from moms and some providers, but we recognize that there's more information that we could gather out there. I think it really is just balancing out at what point do we feel like we have enough information to move forward with some strategies, and how quickly do we want to move forward. So with that, actually, I could move forward with some more information for you, and I think it might answer some of your questions based on the feedback that we got from providers.
I think we
and
have
also
some
from
more
moms.
questions. Commissioner Elliott?
I was going to say, it seems like this is a good starting point. So now that we kind of have an understanding of what the mothers are saying, that kind of fuels a next step toward, and I'm looking forward to the rest of your presentation, but it'll fuel, what maybe our next survey looks like, right? So I think that maybe we could all focus on what the mothers said, and then at the end of your presentation, then we can focus on maybe how this supports what we, survey the larger providers.
Absolutely.
I was just that's my 2 cents, sorry.
Can we try and let Carmen get through her presentation? All right. No.
I'm glad you're all so excited about it.
Yeah,
it's really good. It's an important topic, so it's great to see
We'll let
this
you
passion.
conclude, and then we'll have questions, I'm sure, and commentary for you afterwards.
Okay,
Thanks.
thank you. So I'm actually going to start off with the provider survey results. And so again, there were 10 providers. They were lactation consultants that completed the provider surveys. We did all of this online, actually. And so we actually asked them questions about what they hear from the moms, because they're working directly with the moms and have that direct contact. So we asked them questions about, how did their clients hear about the services? What barriers do the moms state they have come across? Why are moms saying that they want to continue breastfeeding or to stop breastfeeding? So here's some of the information. Over half of them, 56%, of the providers felt that moms learn about breastfeeding support from doctors or hospitals, 22% from family and friends, and 11% from WIC. This might not be surprising to you, but according to providers, the barriers that moms state, almost 90% said it was due to cost. Over half, 56%, said it was lack of support from their family, and also challenges with being able to breastfeed due to school or work. Reasons moms state they continued breastfeeding, over 70% was getting support, so getting that help that they need to breastfeed in any multitude of ways. It could be a support group, it could be getting an appointment with a lactation consultant. and 50% said it was support from their family and friends. So you'll see this theme throughout the survey results, that encouragement and support from those around you makes a huge difference. Reasons moms stated that they stopped breastfeeding. All of the 10 providers said their clients say 100% they're worried their baby is not getting enough milk. And then 40% say it's from discomfort or pain. And then we also asked, because again, under the Affordable Care Act, moms are supposed to have access to supplies and services, and that includes a pump. So we asked if any of the moms they've worked with stated challenges in getting a pump and why. Over 80% said their moms did not know how to navigate their health insurance, and 60% didn't even know that their insurance covered it. So that kind of gives you a picture perhaps of how much education we may still need to do in the community at different levels.
Systems, not community.
So in terms of recommendations from providers, we asked them, what do you think needs to be done to improve access to services and support? So they said, actually, education for providers. All different kinds of providers in the community need to know not just about how important breastfeeding is, but where to refer moms, how to get them those services, how to promote breastfeeding. Another thing is to have an integrated system. So they don't see lactation consultant as something that's just separate necessarily. They thought it would be great for it to be integrated, let's say, with the pediatric office or an OB office. So it's a seamless approach, and moms get easier and increased access to those services. Collaboration and knowing what's out there in the community was important. And this was an interesting finding. They actually recommended licensure for IBCLCs, or internationally board certified lactation consultants. There's an interesting thing that actually we weren't aware of until we looked into this, but if you are not licensed and IBCLCs are not considered licensed, you cannot bill certain funding streams like Medi-Cal. So it creates this really interesting disconnect. There's supposed to be services and supports, but if you're not licensed, you can't bill for it. In certain instances, LCs, let's say they are already an OB, a nurse practitioner, an RN, they have licensure, so they could bill. But not everybody that's a lactation consultant has that licensure. They may also be able to work in a setting like a federally qualified health center, or work under a licensed provider, and that may be one avenue. But again, not everybody's in that situation. They might not be in a hospital, for example, so you don't have that community-based support available. So of course, the providers mentioned improving the ability to bill and improve rates. And then just again, supporting any policies out there that really promote breastfeeding at both the local and state level. So I wanted to also then move on to the breastfeeding mother survey results. And this was really exciting for me again to see that we had 492 mothers complete the survey in just a matter of weeks. We utilized social media to promote the survey. We appreciate all of our partners, including DHS WIC and CRP WIC, really getting the word out there and encouraging moms to take the survey. So these were moms in Sacramento County that are currently breastfeeding or have breastfed any amount in the past 3 years. And we wanted to get a feel from them about if they needed services, what were their experience like, what barriers did they have, what recommendations do they have. So I'm just going to go through the next couple of slides. They're a mixture of percentages written out like this, but also some graphs as well.
Commissioner Jones has a question for you.
Sorry. Hey, was the survey to Medi-Cal mothers, or is this survey to every mother?
It's to every mother. We
So it
did
didn't-
not.
okay.
We did not ask them if they're on Medi-Cal, if they're on WIC. We just opened it up to all mothers because we wanted to get a picture of just in general what's happening in Sacramento. Okay. So we wanted to know, how did moms hear about breastfeeding support services? About half heard from WIC. 56% heard from a doctor or nurse, so that mirrors what the providers said. 45% got an information packet from their doctor or doctor's office. 36% from a family or friend, and the rest a mixture, small percentages of online brochures. Only 6% a referral from an organization, and 2% didn't know. with regard to, just to let you know, the focus group results also reflected very closely to what the survey results said. Many participants heard about services either through a doctor or through WIC. So when we asked moms, did you need help with breastfeeding in the first year of your child's life? You'll see that a significant number, 77%, needed help with breastfeeding in the first year. So we wanted to know if they needed help, and then if they got help with breastfeeding, where did they get that help and what did it look like? So immediately after delivery, 4% of moms got no help at the hospital. Those that did get help, 40% got help from a hospital nurse and 45% got help from a lactation consultant. So we do know that there are some lactation consultants at the local hospitals. I think it's important for us to know, and we just had a lot of conversation about what's happening at the hospital level. I think it's important for us to look at what's happening at the hospitals, but to also look beyond that. Because the hospital stay for a mom that delivers a baby is very short. And in that time frame, she's still establishing her milk supply, and it may still be a couple of days before her supply is established. And there are many challenges along the way with breastfeeding that are yet to come. So I don't want us to just focus on just that very short time period. Important, but let's not just focus on that short time period. So we also then wanted to know postpartum. This is in the coming weeks and months after the mom has the baby, and she's interacting with different providers in the community, whether it's her own OB at her follow-up, or it may be with the baby's pediatrician. So we asked, at routine checkups, did your doctor or the baby's pediatrician offer any breastfeeding help? Surprisingly, 45%, that's almost half, said no. 19% gave them printed materials. 19% did refer the mother to a program, and then about 17% helped the mom. They stopped and helped her and showed her how to latch or reposition, whatever it was. So that's what's happening to the mom both at the hospital immediately after birth and then postpartum. So in terms of finding breastfeeding support services, we asked, what barriers did you face in finding breastfeeding support services? 262 mothers answered this question, and you'll see almost 10% said they couldn't find a provider. 42% didn't know who to call. Another 24% said a barrier was cost. Almost 13% said transportation was a barrier, like meaning transportation getting to the appointment. About almost 32% said that they could not find help available soon enough. So sometimes they would try to get an appointment, but perhaps it would be days or maybe even weeks out. And when you're breastfeeding, sometimes you need that help pretty immediately. And then the remaining 20% said they didn't find the provider very helpful for any number of reasons. I looked at some of the comments, and some said the provider just didn't give them enough information, or they felt very rushed, or they felt that they weren't being listened to. There's many, many reasons, but those are just a few that we saw. In looking at the moms that were able to use services, what barriers or challenges did they face in using those services? So again, cost came up as a factor. Transportation, a provider not being helpful, and appointments not being available at a convenient time of the day for 30%. And again, the date of an appointment not being available soon enough to meet their needs was an issue for 26%. And then the last one, I apologize, the words got cut off, but 1.65% said the services were not available in their language. So they found that to be a challenge. We also asked moms if they used breastfeeding support, then we wanted to get a feel for what kinds of services did they use in the community. So about a little over 13% used a breastfeeding helpline. More than about 3/4 utilized appointments with a lactation consultant. So it looks like that one-on-one help is really important for moms. A little over 20% utilized a breastfeeding support group. 33% utilized a breastfeeding class, and about 39% utilized a pump rental. So it's really interesting. We had this assumption, I had this assumption that a lot of moms were going to say they just couldn't find services available and that they would have a really difficult time finding services in the community. Interestingly enough, we were surprised that 46% of the moms said it was pretty easy to find help. 33% said it was fairly easy. They got help after a short amount of time. 11% said it was challenging. They had to really research and advocate for themselves and make multiple calls. And 2% said it was impossible. They gave up. So I didn't include a graph on that, but I just wanted to put it as an aside for you to get some additional background information. We wanted to know then for those moms that utilize services, how do the services help them continue to breastfeed? And so I think these results shouldn't be any surprise to most of us. Over 50% said it gave them the confidence to breastfeed. Almost 60% said it gave them education and encouragement. Almost 30% really found it valuable to get support from other moms, just to hear from other moms and know that they're going through some of the same experiences. Almost 57% said that the services helped them resolve a specific challenge or problem with breastfeeding. And then lastly, over half of the moms said that they got the tools they needed to really successfully breastfeed. We also wanted to know what encouraged moms to continue breastfeeding. And again, as I mentioned, you'll see these common themes that came up. A huge thing about breastfeeding is getting support from family and friends. 72% said support was really important. 31% said support from the doctor helped them continue to breastfeed. 67% said supplies to help them. 46% said a supportive school or work environment, including a flexible schedule and a clean and private place to pump, was important. So that leads us back to the conversation that Julie had earlier in her ED report about SB 937. And then 46% found that community program staff really helped them with breastfeeding. So with all this information, what recommendations do moms have regarding breastfeeding support services, and how could we improve in Sacramento County? So they definitely agreed that hospitals and providers should encourage breastfeeding. That's some of the first providers they see as soon as they have the baby. So I think the baby-friendly work continues to be important in the community. But they also felt at the same time that providers needed more training. They want to hear the information about breastfeeding, not just once, not just after the baby's delivered, but they wanted to hear it early and often from different people. They want to have increased awareness of and access to pumps and really figuring out the easiest way to get there. It shouldn't be a convoluted mess where they have to call multiple times and get bounced from one line to another. So they wanted to see that streamlined. Definitely to have support for breastfeeding and pumping in the workplace and in public, because a lot of moms do return to work. And being able to have that clean, safe space to pump is important to the continuation of breastfeeding. They advocated for home visits and help with breastfeeding postpartum, because they do say when you have a newborn or a young child, it can be really challenging to leave the house. And for those moms that say transportation is an issue, it can be so valuable for them to have someone come directly to them and check on them and assist them with breastfeeding. So that would then again give them more access to lactation consultants. And then just resources available online and social media. So many people use social media now for information, and it could be a really quick way for them to look up information or get support from other people. So you'll see some of these recommendations from providers and moms kind of repeated here, but these were our interns' research project recommendations. And it's broken up in 4 categories. So it's education, social support, navigation tools and resource materials, and again, systems change. So as I've already mentioned, the education is important for both mothers and providers, and to have that happen regularly at all levels. So directly to the mom, to the support staff, to the direct service providers. Social support, one of the things our intern recommended was maybe we should create an online app or some sort of social media app for moms to access to so they could chat with each other about some of their challenges and have it moderated by a lactation consultant so their questions can get answered pretty immediately. And then in that kind of platform too. Moms are able to provide tips with each other and just give each other that moral support that can go a long way, as you can see from the survey results. Having support from friends and family really did make a difference for these moms. And as I already mentioned, the home visits and face-to-face support, and just knowing how to navigate insurance companies. And then finally, as we've mentioned, working to change the ability for lactation consultants to be able to bill under funding streams such as Medi-Cal. So our next steps, just to conclude my presentation, we did share this information with the Sustainability Committee and got a lot of interesting questions, a lot of interesting feedback. I think I got the sense that there's so much more that we could do, we could learn. We're just trying to figure out what the next steps are. Julie did share this concern about the ability to build a medical system with the First Wave Association, and we're hoping that they include it in their policy platform. And we'll need to continue our efforts to work with our local health plans and health systems to really streamline that process and get our moms and babies access to the services that they should have under the Affordable Care Act.
Thank you.
That concludes my presentation.
Thank you, Linda.
Thank you.
I believe I owe you an apology. I think I called you Carmen earlier.
That's okay, I'll answer.
I'm suffering a little bit of jet lag right now, so.
I didn't notice,
I apologize. Okay, I know that commissioners are eager to ask questions or provide commentary. I'm going to go ahead and start with a question of my own. There's a kind of a theme throughout the findings here from the survey that there's concern about cost. So what do we know, drilling down a little deeper about cost? What is it that is of an expense nature that is proving to be an impediment to mothers seeking lactation consultancy or renting a breast pump? What is the principal reason why that is a concern to mothers?
I think the cost can vary. It depends if they get coverage. But for example, if you have a private appointment with a lactation consultant, sometimes it could be more than one appointment that's needed, and I believe it could be like $100. I'm going to turn to WIC and see if they know.
Okay.
So for those of you that might have heard, it could be anywhere from $75 to $125 to $150 per appointment. And so that could be a lot for a family, and sometimes an issue is not resolved in one appointment. So that's an example of a cost factor. And then if they don't have transportation, then they're paying for transportation to get to that appointment. Sure. Pumps can vary in cost. There are manual pumps, which I believe are a little bit cheaper, but they're not always the most user-friendly. So then you have the electronic pumps, which could be a couple of $100s. And then you have the supplies that you need to pump. So it all adds up very quickly. I'm going to turn to WIC. Do you guys have anything else to add about cost?
Yeah, why don't you come down to the microphone?
Hi there, everyone. My name is Jeanette Newman-Velez, and I'm the Breastfeeding Promotion Coordinator for CRP WIC, one of the funded programs. Thank you again for your funding. So Linda is correct. The concerns are about mothers' perception of the cost, going back to the lactation consultants, afraid that they won't be able to afford that, but again, the pumps, and just there's another cost. They're afraid about the time it's taking away from their work if they actually breastfeed, because they don't see that they can do this and work. They feel like they have to make a choice between actually breastfeeding and continuing work, because they don't understand that. And we are really trying to educate them about their rights. The lactation accommodation laws that exist here in California, but also federally. We're doing a lot of work with that within the WIC program and in other venues. It just, that perceived cost, and also that I have to be the only one that gives the baby my milk. They see that as also a cost in terms of families can't help, so we try to educate them that that's not the way it is either. But it's sometimes getting into their head and understanding what's going on with that. And if I could can I take this opportunity to comment on Commissioner Jones' questions about the hospitals, and are they educating them about formula, or are they saying, do you want to breastfeed? Yes, they are. It depends on who's there. It depends on if it's a night nurse or not, because sometimes they really want the mothers to sleep. The nurses are doing that out of good intention, but they don't realize that the mother needs help to breastfeed and the baby's going to wake up. So that's a difference too. And also to mention, there are local hospitals that have just gotten certified. Mercy San Juan did get certified. It took a good 4 years. And when First Five was so generous to offer money to the different hospitals, Mercy did take them up on that, at least Mercy San Juan. UC Davis politely declined, and now they are just getting administrative support. So when was that, 8 years ago? 8 years ago, we were going and we were approaching them, and they were saying, thank you, but we're doing fine all right now, because their breastfeeding rates looked higher than everybody else's. But the administration finally is buying in, and they see that it would behoove them to do what everybody else is already doing. So they're finally just now getting to that point, even though we planted the seeds many years ago. So it just takes time. We make the offer, but sometimes the ground isn't quite ready, and now the ground is getting ready at other hospitals. So it's a process that's happening.
Why don't you stand by, because we have a number of folks in the queue here that have questions that maybe you can help answer. So first Commissioner Elliott, then Commissioner Moak.
So for time, I'll keep this short. I'm sorry I missed the last sustainability committee, so I'm actually probably going to put together some comments, send them over to Donna, and just make sure that I don't want to repeat things that have already been said. So I'll just be really quick. My first thing is there is an application. So it's been a while since I've been to a Sacramento Breastfeeding Coalition meeting, but I do try to go as much as I can. And there was a proposal for an application called Liquid Gold. And it is the purpose of it is for providers in hospital and healthcare systems, and it's like a startup, right? So do you guys remember this, the Liquid Gold concept?
I do.
Yeah. So I mean, it's not something that's currently available to the public, but they're working from the health system side to get hospitals to adopt this app that their nurses and their doctors can use to help assist women with breastfeeding. And it's like a simulation. So, I just give that to you guys as information and reminder that could be, there are things out there, and I'm not promoting that. So I just, cautionary tale, I'm not promoting that application or anything publicly, but just as an example that there are applications. And the other thing, with respect to the employer piece, based on the legislation that failed, I work for the state. It's, as Scott said and looked at me, isn't it illegal to not let your staff pump? It is. However, it's not necessarily enforced. With my second daughter, I had a C-section. My milk didn't come in as quickly as it did with my first daughter, where naturally, and your body is just very susceptible to whatever the environment is. So I think that and again, it's about the work on the employers. I would like to in the future utilize this survey to fuel communications for sustainability. But as a state worker, I had a boss that didn't let me pump, and I lost my milk because she would schedule meetings right when I had put on my calendar that I'm scheduled to pump. And she'd be like, there's a deadline of 1 hour for this, which is, it happens. So we like to say it doesn't, and that there's laws in place, but it's about educating and enforcing. And so, again, I'll put my questions together for Donna. And again, I'm sorry, I think my calendar, I didn't know that that we had an evaluation meeting. So it got canceled off my calendar. So you guys probably think I'm not showing up to stuff, but I had a legitimate reason. So I just want to keep it short. I'll just do that, and that way it gets communicated.
Thank you. Commissioner Moak?
Thank you. I guess overall, we've over time invested quite a bit of money into breastfeeding support and activities at the highest level of policy work and hospital conversion down to grassroots, level. I just want to make sure, I guess a couple questions is, I want to make sure that when we're embarking on a survey like this, we're doing it with the utmost care with who we're trying to seek information from. Those 490, the N that was 492, I'd be more apt to wonder what our first 5 families are saying, I guess, than, no offense to any mom delivering up in El Dorado Hills or Granite Bay, but I don't care as it relates to this, our work with First Five. So how many of those families are in this 492? I don't know if we know, but I'm hoping it's 0, but I don't know if it is. So I guess that's first part of it, knowing that we've invested a lot of money for a long time, and then to see some survey results show that it's not painting a very pretty picture around, only half are getting the help they need, and nobody knows, they don't know who to call, and providers aren't helpful. Those are all things that we've invested and continue to a good amount of money into showing that it looks like crap. So I want to make sure that where we're putting our money is the right place, and I guess I want to know what the overall goal of this almost presentation is. We know we just slashed this topic area a couple years ago. Did we make a mistake by cutting breastfeeding services and support? Because now is this look at what happened after we cut all the services? So are we saying we want to think about reinstating? I guess I want to know a little bit of what our goal here is.
No.
Sorry, that was a lot.
No, that's okay. And no, we're not saying that. I think we have to make cuts. This was one that we cut. The cuts just started in July, so this wouldn't have this big long impact yet. So these are moms that have breastfed sometime during, or didn't breastfeed. These are women who had children sometime within the past 3 years. So I'm bringing it forward, I think, because it's part of our sustainability efforts, and for all of the programs that we're cutting, we picked up policy areas around each of those. And I guess I'm just trying to show the commission that this is our first step into what can we do around breastfeeding. We made a 20% cut there. We know we have additional cuts coming in 3 years. We sort of made a promise to the commission that we're going to look at fixing systems around breastfeeding. One of the things we really wanted to do was find out what are those barriers, because again, we have heard anecdotally, this isn't a randomized controlled study or anything like that. This is just kind of us going out and saying, we have the use of an intern. What are we hearing? This is the first time we've really asked providers, and it wasn't the focus of this survey. But I think in the end, it really is helping us sort of figure out what are the next steps. Would it behoove us to sit down and actually do a survey among the providers and look at the systems? Kind of heard from moms. There might be some educational things we can share back to those providers from this survey. And then also we know that many of the folks who completed this survey probably were WIC clients, because this really helped us boost it out to participants. But it's a question we didn't ask, so we didn't say, are you a WIC person? Theoretically, if you have WIC, you would have a lot easier time getting a lactation consultant, because we're funding those lactation consultants. What would this look like for somebody if we had queried by WIC client or not WIC client? Might look very different. So it really just sort of opened our eyes up to a bunch of questions that we'd still like more information on, but we just wanted to show you we're engaging in it, and we're trying to do good on our promise to look at other ways other than direct funding of direct services. What else can we do?
I'd like to respond as well, if I may. I was one of the clinics that we got it was a lot of our mothers, and I think also at Sac County WIC. It was our moms were filling those out left and right. So it was the base. It was our target. We were getting a lot of those. I was traveling around all of our 7 or 8 WIC offices, collecting them all to make sure we could get them to Linda. It was the first 5 eligible clients that were completing those, whether they breastfed or not, to get what their experience was. So it was educational for us too, because we think we're advertising our services, and as much as we think we are, some of them are not getting, because maybe they're coming from outside our county. We have a lot of refugees coming in and they may not be aware, so there might be some of that going on too. But I wanted to touch on what Julie was saying about kind of where do we go with this? What can we use? And I think it's trying to make an impact on the system changes by letting healthcare, the different healthcare providers, I'm talking about not at the direct service level, but the health insurance providers. If this is something that's supposed to be covered as a benefit and it's not getting implemented, where can the commission use their voice to say, can you make this possible? Because that's where I see it having a long-term systems change. I'm going to use an example. Kaiser has set up a system so when a baby goes to a well checkup, they're going to the pediatrician, and right after they see the pediatrician, they see a lactation consultant. It's built in, it's seamless, it just happens. Now, not every health system can be Kaiser, but they could have something going. Sutter's starting. Sutter Medical Center has started to have an outpatient lactation clinic. It's primarily for patients that deliver there, so that's good, and they figured out a way to bill Medi-Cal. But they've started opening it up in a few situations to mothers that just need help if they can't get into us for some reason. So that, to me, is a systems change. Mercy is trying to do the same thing. And just to add on, as far as, I mentioned that Mercy San Juan is working on that. They are trying to see, again, how they can do the billing. That's the part that gets tricky. But if we can work at that level, I think then we're not just feeding the system for a day. We're making sure that it goes long term. That's what all of us want to do, right? We want to make this not just for a 1 day or 3 years. We want to make it so it's self-sustaining, using the systems that are having. And I think it's going to those health care systems and saying, why isn't this not getting implemented in your system the way it should be?
Thank you. Commissioner Jones?
Again, thank you. I haven't said that, and I want to emphasize, thank you for the presentation. I think it's a very important subject, and this survey, based on some of the input that we have talked about, has the potential, surveys in the future, to really answer a lot of very important questions about how we target our programs should we decide to fund them. I wasn't clear if I understood Supervisor Cerna's question, if it was answered. So are electronic breast pumps covered under the ACA, so they would be free to the person either to rent or to purchase? And second question, do we have enough electronic breast pumps for anybody on WIC to have them? And 3, do we have enough lactation consultants for the systems to help with any person who needs this kind of service?
I can try to answer a couple of those questions. Under ACA, it just says pump, it doesn't specify. So there's a lot of room for interpretation by different insurance companies and different providers. So we have heard anecdotally some moms state, I got a pump, but it wasn't that great. It's a manual pump, or it just is not a easy to use pump. In terms of the number of lactation consultants, I'm not sure how many we have here in Sacramento County. Lisa Matthews from DHS WIC wanted to respond to some questions. Do you know?
So, like Linda said, my name is Lisa Matthews, Breastfeeding Program Coordinator with the Sacramento County WIC program. I do want to mention with the pump provision of ACA, there's 2 different types of pumps. It's the pump rental. If mom has a baby in the neonatal intensive care unit where she needs to pump and baby stays in the hospital, she can rent out that pump for a set period of time. If she does that, then she is no longer eligible to receive a personal grade pump to where she can use it for back to work or other engagements that she has. Usually that provision is 1 pump every 3 years. So if she doesn't hang on to that pump with her first baby and her next baby comes a year later, then she's out of that pump. Also, with the personal grade pumps, there aren't standards among all of the insurances of what pumps are provided. So you could have a really great pump over here by a certain company, and then over here you have one that's a lot less effective of getting the milk out. And some insurances are giving manual pumps instead of an electric breast pump. So not all of the pumps are meeting the needs the moms have.
I'm sorry, if I could add one thing. I also, from what I understand, for at least some of the insurance companies, you have to get a prescription from your doctor to get a pump. So it's not like you can just call and say, just had my baby a couple months ago, I'm going back to work, I need a pump. There's a process that you have to go through and multiple calls that you have to make. And then paperwork you have to submit in order to access that pump.
Commissioner Wirtz?
Thank you. Couple comments. I think the first, just to deal with the data side of things, this is a convenience sample because you had limited resources and you wanted to get information. It's exploratory, and therefore it has the limitations of a convenience sample. We don't know fully who was in and who wasn't in, so that's the first thing. Second thing, in terms of looking at the charts, I just want to sort of highlight something that I think may distort the findings a little bit and make them look better when you understand that moms were responding with checking all that apply. So 50% said they got confidence from this, another 60% said engagement. So that could be that the mom is checking both of those things and so on. So it changes these numbers. You wouldn't expect them to be 100% because they're choosing among various things. If you add these up, that's well over 200% are saying they had something. So I just wanted to clarify that to help on that. So that's a couple of comments on the methodology. The second thing, I am a little frustrated with this, not because of what First Five is doing or what we're doing in Sacramento, but because my first published article was, I think, in 1988 on a randomized controlled trial to stop hospitals from giving out infant formula packets. And I was a board certified lactation consultant for many years. And here I'm hearing things that I thought we resolved last decade or last century. And hearing that the major reason that providers are saying that women stop is because they don't think they have enough milk is the most basic issue of misunderstanding around breastfeeding that exists. So I'm just frustrated, not because of I'm just frustrated that we haven't moved forward in 40 years or whatever it is. I'm only 23, so I don't. The second thing, Scott mentioned that we've been putting a lot of money into this, and I think we've really built some capacity in Sacramento around lactation consultants and so on. But I want to stress again that it was really hard work for us to get a $25,000, and I'm getting it right this time, amount of money on the policy change side per year. And that's nothing compared to what we spend for many other things. So I loved your comment about institutionalizing the practices within institutions. And I think that's where there should be it's just frustrating. I mean, we did in Boston City Hospital is where we did our intervention. We used both volunteers from La Leche League and from professional lactation consultants. And so one of the fundamental things I want to respond to you, Linda, on is the concern about making sure that promoting breastfeeding is truly promoting informed, supportive choices for women to make for them to succeed. Our outcome measure was not how long women breastfed, but how they perceived their experience in that and how much choice and engaged or empowerment they felt around their choices. So supporting breastfeeding is not about forcing one option on another, but it's really like we do in public health. We talk often about making the right choice the easy choice. If you're stopped at every way, if everything is a burden to get to an appointment, to have to pay money for support, to not be able to get pumps that work properly, all of those things make the right choice the hard choice. And one of the major ways of changing that is policy change. And certainly the insurance component of this is one that I hope the Sustainability Committee does focus on. But I will continue to argue that the first place that breastfeeding is undermined is in the delivery room, or prenatally, excuse me, and so on. But once we, in the delivery room and then in the hospital, and how the structure of the hospital is set up, and that's a policy issue, and we should pursue that. Obviously, I agree with Linda that once you walk out of the door and it's 2 days, if you can't get support, you're going to have trouble, and you're going to feel like you don't have enough milk because that's the obvious perception. You want the best for your baby. So I just have to sort of say that I think we need some further work on the policy side of this, and I just urge it on to the Sustainability Committee. So thank you for the time.
Commissioner Wagstaff.
Thank you, Mr. Chairman. Could you clarify or say again what the fix to Medi-Cal needs to be as part of our next steps?
So lactation consultants are not considered licensed providers, and only licensed providers can bill. So unless a lactation consultant is licensed otherwise, as a nurse, a doctor, etc., they can't bill.
To your knowledge, is there any federal restriction? Is this a state issue?
It's a federal, right?
It's under the ACA, that's prohibited?
I'm
I
sorry, to
actually
clarify.
think it's a state issue because I had been told by colleagues at First 5 LA that some states considered an international board certified lactation consultant as a licensed professional, but under Medi-Cal, they can't bill because in California, they didn't consider it. So I would have to research that, but that is what our association was discussed at this policy hackathon that we were at. And First 5 LA said they will definitely be putting this on their priority platform, and the association, I think, was right behind them. So just even bringing it forward to be discussed there, I think resulted in some change, or at least some advocacy work that's about to happen to try to fix it for California.
Well, I would just say, Mr. Chairman, and to the staff, in terms of concrete next steps that we might take here, I'm glad you're looking at this with the statewide association because you're going to get a new legislative session, you're going to get a new state administration. It's a perfect time, I think, to raise some of these fixes to this very important area. So I would strongly recommend that you pursue that and any other changes to Medi-Cal that might be necessary. Given the theme of the cost associated with this, that would go a long way towards addressing that. Thank you.
Commissioner Gordon.
Yeah, I just wanted to raise more a procedural question. This is obviously a very important issue, and I think the survey was the first piece of helping us understand it. I don't know that the survey in itself helped us understand what Commissioner Wagstaff and others have been talking about. So I think if our process is going to be the Sustainability Committee reviewing potential impact of reductions we've made, it would be good to charge them with also bringing us the policy recommendations in a package along with the information as a way to go in the future. But I think this is extremely important, and I hope we can move forward with it quickly and use a system like that into the future.
I hope so.
Okay. Commissioner Elliott.
I don't need to speak. That was what I was going to say. Yeah, we'll be bringing this forward, and I'm sure. Yeah.
Okay.
Oops, sorry.
Yes.
Sorry, I just wanted to.
Why don't you stand between the mics? There you go.
I just wanted to bring a little bit more information towards Commissioner Moak's question about what have we been able to do with the money. In terms of an evaluation standpoint, our breastfeeding rates at any age, 0 to 1 year, are double that of those that haven't received any First 5 service. So we are seeing quite a big impact in what we're able to provide to our families if they're able to receive First 5 funded lactation service. So I just wanted to provide that information.
Thank you very much.
Can you also, if I could, just give us a reminder of what the rates are in general for Sacramento versus the state and nationally? I think they're not. I think they're better than the state.
I would say, off the top of my head, I want to say that First 5's funded lactation services for infants 0 to 1 year is around, I want to say 40 to 45% compared to 20 to 22%. The state average is somewhere around 20%.
17.
And this is at 6 months? Or 3 months?
This is infants of all ages from 0 to 1 year. So looking at...
Okay, it's more important to look at initiation and then exclusive versus partial and then length of exclusive breastfeeding in terms of benefits. And I know you presented that data, and my main point was just to say that it seems to me like this is an area that we've improved over comparable locations. So I just want to make sure there's plenty to do, as you can understand, but we are making some real progress.
Right. And those differences are consistent when looking at the 6-month time age and then also at the 11th month, which we look at that first year. So those changes are measurable and significant.
Great, thank you. Obviously, members of the commission are very interested in this subject matter, so certainly appreciate the presentation, and we look forward to further work by our sustainability committee on it. So thank you.
Thank you. May I take one more 30 seconds of your time, commissioners, if you don't mind? We were talking
30
about
seconds.
30 seconds. Ready, set, go. I also represent, and Lisa does as well, the Sacramento Breastfeeding Coalition. We see this as a way of building collective impact. It's a nonprofit. We're all volunteer, and we're actually having a strategic planning meeting on October 16th. So if any of the commissioners would love to lend their support by showing up, we're going to have Dr. Jane Heinig, who is the executive director of the Human Lactation Center based at UC Davis. She's a world expert in lactation topics as well as just infant nutrition. She's going to be leading us envisioning what we're doing with the next 4 years. So if you'd like to be part of that, we see this as a way of working to build collective impact. So using the work that we're doing here through First Five, but also using the greater community. A few things that we've done as a coalition is we actually held this August, we had a special presentation with an African-American lactation consultant to see how to build more lactation consultant specialists in our community so that we have more cultural diversity, and see about getting that basic breastfeeding information into the different FRCs so it doesn't have to be, not everyone has to be a lactation consultant, by the way. We can just take the information that people are already working with and help build on their skill level. So we're doing a lot of great things, and I have flyers for all of you that I'll leave with her, if you don't mind.
Great.
Taking one if you're interested. Thank you.
Okay, last item of the afternoon is comments from commissioners. Any comments? Looking to my right, looking to my left, not seeing any. All right, if there's no further business before this commission, we are adjourned.